In this lesson, now we are going to talk about dementia from Wikipedia, the free encyclopedia, especially diagnosis of dementia. In particular, we will talk about the cognitive testing, laboratory test, and imaging of dementia. So, let's enjoy the reading on the diagnosis of dementia. Diagnosis. Symptoms are similar across dementia types and it is difficult to diagnose by symptoms alone. Diagnosis may be aided by brain scanning techniques. In many cases, the diagnosis requires a brain biopsy to become final, but this is rarely recommended, though it can be performed at autopsy. In those who are getting older, general screening for cognitive impairment using cognitive testing or early diagnosis of dementia has not been shown to improve outcomes. However, screening exams are useful in 65 plus persons with memory complaints. Normally, symptoms must be present for at least 6 months to support a diagnosis. Cognitive dysfunction of shorter duration is called delirium. Delirium can be easily confused with dementia due to similar symptoms. Delirium is characterized by a sudden onset, fluctuating course, a short duration, often lasting from hours to weeks, and is primarily related to a somatic or medical disturbance. In comparison, dementia has typically a long, slow onset, except in the cases of a stroke or trauma, slow decline of mental functioning, as well as a longer trajectory from months to years. Some mental illness, including depression, psychosis, may produce symptoms that must be differentiated from both delirium and dementia. Therefore, any dementia evaluated should include a depression screening such as the neuropsychiatric inventory or the geriatric depression scale. Physicians used to think that people with memory complaints had depression and not dementia because they thought that those with dementia are generally unaware of their memory problems. This is called pseudo dementia. However, in recent years, researchers have realized that many older people with memory complaints in fact have MCI, the earliest stage of dementia. Depression should always remain high on the list of possibilities, however. For an elderly person with memory trouble, changes in thinking, hearing, and vision are associated with normal aging and can cause problems when diagnosing dementia due to the similarities. Given the challenging nature of predicting the onset of dementia and making a dementia diagnosis clinical, decision-making aids underpinned by machine learning and artificial intelligence have the potential to enhance clinical practice. Cognitive testing. See also cognitive inhibition and executive dysfunction and testing and measurement. Various brief cognitive tests, 5 to 15 minutes, have reasonable reliability to screen for dementia but may be affected by factors such as age, education, and ethnicity. While many tests have been studied, presently the Mini Mental State Examination MMSE is the best studied and most commonly used. The MMSE is a useful tool for helping to diagnose dementia if the results are interpreted along with an assessment of a person's personality, their ability to perform activities of daily living, and their behavior. Other cognitive tests include the Abbreviated Mental Test Score, AMTS, the Modified Mini Mental State Examination, 3MS, the Cognitive Abilities Screening Instrument CASI, the Trail Making Test, and the Clock Drawing Test. The MOCA, Montreal Cognitive Assessment, is a reliable screening test and is available online for free in 35 different languages. The MOCA has also been shown somewhat better at detecting mild cognitive impairment than the MMSE. The AD8 and a screening questionnaire used to assess changes in function related to cognitive decline is potentially useful, but is not diagnostic, is variable, and has risks of bias. An integrated cognitive assessment, COG-ICA, is a 5-minute test that is highly sensitive to the early stages of dementia and uses an application deliverable to an iPad. Previously in use in the UK in 2021, COG-ICA was given FDA approval for its commercial use as a medical device. Now let's see the sensitivity and specificity of commonest test for dementia. Test MMSE, sensitivity is 71% to 92%, specificity 56% to 96%, reference number 76. Test name 3AMS, sensitivity 83% to 93.3%, specificity 85% to 90%, reference number 77. Test name AMTS, sensitivity 73% to 100%, specificity 71% to 100%, reference 77%. So we have looked at the scale and the test name MMSE, 3MS, and AMTS with their sensitivity, specificity, and references. Now let's enjoy more reading on dementia diagnosis. Another approach to screening for dementia is to ask an informant, relative, or other supporter to fill out a questionnaire about the person's everyday cognitive functioning. Informant questionnaires provide complementary information to brief cognitive test. Probably the best known questionnaire of this sort is the Informant Questionnaire on Cognitive Decline in the Elderly, IQ code or IQ-CODE. Evidence is insufficient to determine how accurate the IQ code is for diagnosing or predicting dementia. The Alzheimer's disease caregiver questionnaire is another tool. It is about 90% accurate for Alzheimer's when by a caregiver. The general practitioner assessment of cognition combines both a patient assessment and an informant interview. It was specifically designed for use in the primary care setting. Clinical neuropsychologists provide diagnostic consultation following administration of a full battery of cognitive testing, often lasting several hours, to determine functional patterns of decline associated with varying types of dementia. Test of memory, executive function, processing speed, attention, and language skills are relevant, as well as test of emotional and psychological adjustment. This test assists with ruling out other etiologies and determining relative cognitive decline over time, or from estimates of prior cognitive abilities. Laboratory test. Routine blood tests are usually performed to rule out treatable causes. These include tests for vitamin B12, folic acid, thyroid stimulating hormone TSH, C-reactive protein, full blood count, electrolytes, calcium, renal function, and liver enzymes. Abnormalities may suggest vitamin deficiency, infection, or other problems that commonly cause confusion or disorientation in the elderly. Imaging. A CT scan or MRI scan is commonly performed to possibly find either normal pressure, hydrocephalus, a potentially reversible cause of dementia, or connected tumor. The scans can also yield information relevant to other types of dementia, such as infarction, a stroke, that would point at a vascular type of dementia. These tests do not pick up diffuse metabolic changes associated with dementia in a person who shows no gross neurological problems such as paralysis or weakness on a neurological exams. The functional neuroimaging modalities of SPECT and PET are more useful in assessing long-standing cognitive dysfunction since they have shown similar ability to diagnose dementia as a clinical exam and cognitive testing. The ability of SPECT to differentiate vascular dementia from Alzheimer's disease appears superior to differentiation by clinical exam. The value of PIB-PET imaging using Pittsburgh Compound B PIB as a radio tracer has been established in predictive diagnosis, particularly Alzheimer's disease. So that's the end of our enjoying the reading on the diagnosis, on the different types of diagnosis of dementia. I hope you have enjoyed listening to this video on the processes of diagnosis of dementia. And lastly, I'd like to tell you thank you for subscribing to the channel, and thank you for your comment and for your likes you have made to this channel. And once again, I'd like to invite you to give your comments on any topics of this video, and I must welcome your criticization, your criticism, and thank you very much for subscribing to the channel. All right.